Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. New guideline by ASA. Preventing a first stroke may be possible with screening lifestyle changes. The 2024 guideline for the primary prevention of stroke replaces the 2014 version and is a resource for clinicians in implementing a variety of prevention strategies for individuals with no prior history of stroke. The new guideline provides evidence-based recommendations for strategies to support brain health and prevent stroke throughout a person's lifespan by improving healthy lifestyle behaviors and getting preventive care. The new clinical guideline from the American Stroke Association, a division of the American Heart Association, was published in the association's journal Stroke. Top 10 take-home messages. Number 1. From birth to old age, every person should have access to and regular visits with a primary care health professional to identify and achieve opportunities to promote brain health. Number 2. Screening for and addressing adverse social determinants of health are important in the approach to prevention of incident strokes. This updated guideline includes an orientation to social determinants of health, acknowledging its impact on access to care and treatments of stroke risk factors. Therefore, screening for social determinants of health is recommended in care settings where at-risk stroke patients may be evaluated with the acknowledgement that evidence-based interventions to address adverse social determinants of health are evolving. Number 3. The Mediterranean diet is a dietary pattern that has been shown to reduce the risk of stroke, especially when supplemented with nuts and olive oil. However, low-fat diets have had little impact on reducing the risk. This guideline recommends that adults with no prior cardiovascular disease and those with high or intermediate risk adhere to the Mediterranean diet. Number 4. Physical activity is essential for cardiovascular health and stroke risk reduction. This guideline includes a summary of high-quality data showing that prolonged sedentary behavior during waking hours is associated with an increased risk of stroke. Oral semaglutide demonstrates a 14% reduction in risk of major adverse cardiovascular events in adults with type 2 diabetes in the SOUL trial. The SOUL cardiovascular outcomes trial was a double-blinded, randomized trial that compared oral semaglutide to placebo as an adjunct to standard of care for the prevention of major adverse cardiovascular events. The trial enrolled 9650 people with type 2 diabetes and established cardiovascular disease and or chronic kidney disease. As a part of standard of care, 49% of patients received SGLT2I at some point during the trial. The trial achieved its primary objective by demonstrating a statistically significant and superior reduction in major adverse cardiovascular events of 14% of people treated with oral semaglutide compared to placebo. The primary endpoint of the study was defined as the composite outcome of the first occurrence of major adverse cardiovascular events defined as cardiovascular death, non-fatal myocardial infarction or non-fatal stroke. Researchers at UCF developed novel sponge-like bandage to prevent excessive bleeding. Without proper medical intervention, injuries sustained from traffic collisions, serious workplace accidents, or weapons may result in fetal hemorrhaging. University of Central Florida researchers aim to prevent such bleeding in potentially deadly situations with a new hemostatic sponge-like bandage with antimicrobial efficacy that they recently developed and detailed in a newly published study in the journal Biomaterial Science. The method, Kaushik Mukhopadhyay, Assistant Professor of Material Science and Engineering at UCF and study co-author and his team developed is called Silfoam, as it is more of foam than a traditional bandage wrap. Silfoam is a liquid gel comprised of siloxanes that is delivered via a special 2-chamber syringe which rapidly expands into a spongy foam upon exposure to each other within the wound in under 1 minute. Screening for depression in children having surgery, KCAT mental health assessment tool may help. A new computerized mental health assessment tool may allow doctors to quickly identify children experiencing anxiety or depression before surgery, suggests new research presented at the Anesthesiology 2024 annual meeting. In the small single-center study, researchers found more than half of the children screened had anxiety before having surgery and more than 1/3 had depression. The use of the KCAT tool in pediatric patients in the pre-operative setting is very feasible, and the results of our pilot study show a substantial prevalence of these mental health conditions in this surgical population, said Elizabeth Peely, MD, lead author of the study and assistant professor of the anesthesia and critical care at the University of Chicago Medicine. Anxiety and depression are caused by many factors. Many kids are anxious before having surgery, and the stress of undergoing the actual actual procedure can accentuate it. It is difficult for pediatric anesthesiologists to determine if patients have undiagnosed anxiety or depression or severe preoperative anxiety prior to the surgery. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.